Hi, and welcome to DTV. My name is Kelly Remshevsky, and I'm the Director of Community Health and Wellness and Associate Wellness at Doylestown Hospital. Today, I'm joined by social worker Amy Stein and breast surgeon Dr. Donna Angadi. Thank you both so much for joining me today. I'd love for each of you to tell me a little bit about yourself, how you got into this field, what do you do, and maybe how long you've been in this field as well.
Amy, you want to take that?
Oh, sure. Hi, everyone. My name is Amy Stein. I'm a licensed clinical social worker, and actually my title at Doylestown Health, I am the Oncology Services Coordinator. So I help to bring people into our health system who are cancer patients and help to arrange services for them. I've been a medical social worker for 27 years now, I believe, with the Cancer Institute now going on 5 years. And I'm thrilled to be here and to be next to the fabulous Dr. Donna Angadi.
Well, thank you, Amy.
My accolades.
Back at you. I'd like to say thank you to the township for supporting this so we could speak with residents on a really important topic. For me, I was a nerdy little kid who liked to read and whose parents emphasized the value of continuous lifelong education, and that's a must in healthcare. I'm passionate about it. The last thing I was going to be was a surgeon. I thought I was too squeamish, but I really think you're eventually led to your destiny, and I just love what I do. And it's just such a privilege and honor to be within this community of just amazing individuals and the amazing services and staff that we have at Doylestown Health.
Mm-hmm. Yeah, we are very fortunate at the hospital to have you guys right in this nice town of Doylestown. Mm-hmm. So let's start off with why we're filming this, which is to raise awareness about breast cancer prevention, screenings, and treatment options. Why is this such an important topic? When people watch this, what is so important about breast cancer awareness?
So I'd like to ask anybody who's watching to raise your hand if you do not know a relative, a neighbor, or a friend who has faced a cancer challenge. And I don't have to have a two-way viewer to know that nobody in this audience would raise their hands because we are all impacted by cancer. Breast cancer obviously mostly affects women, but 1% of the time it affects men as well. And because it's a hormonally based disease, it affects other body systems. There's side effects and treatments, but it just doesn't affect the woman or man who is struck or faced with this challenge, but it affects an entire family. Not that all cancers don't, but particularly when it hits younger women who are in prime productive years and still in the midst of raising a family, it is just the biggest challenge anyone in any family can face in life. The other important thing is, though, the more we become aware and educate ourselves, we can have an armamentarium to attack it and screen and catch it early rather than later when the odds are much less favorable. It also helps to raise awareness for funding. Our advances are made based on research. That's so important. Cancer care changes on a weekly basis. New developments come out. And for prevention, yeah, we wish we got to the day that I was out of business and I didn't have to serve or take care of any cancer patients. But until that day, we're still going to be here working hard for you.
Sure.
And just a little plug for why come to Doylestown for your prevention and your screenings. Well, for breast cancer, we have the Clark Center for Breast Imaging is one of our newer renovated parts of the hospital. We see some of the incredible staff here. It's an easy place actually to get to. Some people, are so flustered and scared coming in, especially when they're coming in for their first mammogram. But our Clark Center is actually located in the Art Walk, which is a museum-like hallway leading up to it, and it's really a nice place just to visit. You don't even have to go through the main hospital to get there. If you park in the parking garage or even in the front of the hospital, there's ways just to enter through the Art Walk. And then when you get into the Clark Center, it's almost like a spa-type experience, I'd say. There's a water feature. There's just lovely people there to greet you. You actually get undressed and prepared in the same room that you're getting your mammogram, which a lot of places don't have. So it's very personalized, and you can feel very protected and private at the same time. We have just amazing expert care. The Clark Center is accredited by the American College of Radiology as a breast center of excellence. And our whole cancer center is accredited through the National Association for Programs for Breast Centers, which is a standardized survey that we have every 3 years, a very rigorous survey, I'd have to say, that makes sure that all of our equipment is up to date, our staff is up to date. We continue to always try to do better for ourselves and our patients. And then coming up in the near future is our affiliation with Penn Medicine, which I think is very exciting, for all of us that will have such a close link to one of the best academic healthcare systems in the country. And then finally, just the support services that we have for our patients. We have incredible help for the uninsured, which I'll talk about in a little bit. We can provide rides for mammograms for patients. We have a breast navigator there to hold your hand and help guide you, through your care, as well as a nurse practitioner who's our survivorship nurse who can become involved with your care from the start all the way through to the end. A genetics counselor and myself, a social worker, and we'll all be there to support you.
If I could just add to that too, you can receive excellent state-of-the-art care, but you receive that personalized touch. You really feel like it's homey. You're not a number. You're not overwhelmed with people with other cancer diagnoses to whom you can't really relate. And you can't do anything by yourself in life of much meaning, I believe, as evidenced by the foundation of Doylestown Hospital, founded by 13 women who looked around the Doylestown community at the turn of the 19th century and said, there's a lot of health effects here. They raised some monies. They bought a water truck, watered down the dirt roads, and that singular, elegant move improved the health of the entire community, and that exists to this day with our VIA members, but also very generous community members such as Minford Foundation, now Main Street, formerly Pine to Pink, and they really want to be invested in helping to elevate healthcare in this community, and we're very grateful for that.
Yeah, incredibly grateful.
Yeah, so let's talk about this community. So, Dr. Angetti, you had mentioned that cancer affects everyone, right? And it is very devastating, particularly to people who are raising families in the midst of that. But what is this population primarily? Who do you deal with primarily? I'm sure you deal with the gamut of ranges and ages, but what is the age, gender, race? Is there a certain population that might be at more risk? Let's talk about what you typically see, knowing that it can really affect anyone.
Yeah, surely. So it's primarily women, as we know. That's the singular biggest risk factor for getting breast cancer, and then age is the second biggest risk factor. And we are living longer. The boomers are living long. And I see two populations, those who are at higher risk or are worried about symptom or a finding, and those that are diagnosed with cancer. And among those people, there are people who screen, and screening is important because, again, we find things earlier, and there's greater outcome, higher cure rates, survival rates doing that. But there's a lot of women in this population for a variety of barriers or reasons, fear, financial misperceptions, and Amy will talk about that in a bit, who delay care and present to us only when they're in trouble. Fortunately, most of the stories are happy. So this should be uplifting, not gloomy, so to speak. Quickly, what are some risk factors for breast cancer? Well, everyone hears about genetic risk. Now, that will account for about 10 to 15% of the cancers that we do see. And there's a variety of risk factors that you can control and that you can't control. What can't you control? You can't control when your menstrual cycle first comes on. You can make a choice, but maybe not control how soon you have children. You can control what you eat, whether you exercise, and whether you choose to take external hormones, which can increase risk.
Okay, wow. You mentioned screenings, and we know that screenings is one of the easiest way to find cancer. What are the types of screenings that you typically promote? who should be screened, when should they be screened. Let's talk about all the ideas around screening.
Sure. Yeah, this is a hot, generous topic for sure. Let's first talk about what does it mean when we screen for cancers? Well, we look for it in a variety of ways depending on what part of the body we're talking about and whether or not that cancer exists to a greater degree in a certain population. So for example, in Japan, they screen for esophageal cancer. Unless you have a high-risk reason, we do not do that in this country, screen everyone, because it doesn't exist at a high rate. In the United States, breast cancer currently is running at about 13% of the population, 1 in 8 women. And it's significant enough that we do put energy and resources into screening. So through the years, what's evolved are a variety of techniques to look for cancer on an early basis, from physical exam to old xerograms to thermography, mammograms, ultrasound, and MRI. The mainstay of screening of our population is mammograms. So when we look at a test in medicine, we want to know if there's disease present, will a test find it? Okay, how good is it at finding it? This could be, you think it's an inexpensive test, but if it only finds 50% of cancers, we're not serving 50% of people. That's a pretty huge amount of people. On the other hand, conversely, if a test finds every single thing that exists and causes a lot of scare, a lot of expense tracking it down, maybe that's not the best test to fit. Ultrasound is an adjunct to mammogram. Now, if you're in a country where services are sparse and that's all you have, it's not bad. It's not going to find as early cancers, and it will miss some cancers. That's why we don't use it only. And I do want to speak to fear that a lot of people have about radiation exposure and dose. I run into that on a weekly basis. First of all, let me tell you that the X-ray radiation that you would be exposed to on an average mammogram, which is 4 views. Now, 3D mammography looks through thicker, denser tissue and is a little bit more of an exposure, but it's basically 0.07 units, okay? In medicine, we have to find terms to complicate things, so it's not important to say what those units are. What we do know, sadly, from nuclear accidents and from wartime is that it takes 30,000 units to cause cancer in the body. Mammography, 1 year on a yearly basis, gives us 0.07. So if you do the math, you'd pretty much have to show up every 2 minutes for the rest of your life for a mammogram to cause a cancer. And once it's framed in that way, people seem to understand it and they're not as fearful to come and get that. MRI is a test that's used for high-risk women because it finds a lot of things that are not cancer. It's the only screening test shown to save lives in that high-risk population. No radiation dose, it's a magnet.
So a mammogram is our standard tool, and then if we need to go beyond that, you'll use other tools to get, if they're higher risk
Correct.
patients, to get that cancer diagnosis or not diagnosis.
Exactly,
It could
to
be either
exclude
way.
it. Now, another confusing thing for the public is a variety of organizations in the medical community have different recommendations for screening, and even fellow practitioners find that confusing. They ask, what is up? Why can't you guys just say do this or do that? Well, there hasn't been a ton of literature, and the literature that is out there, a lot of it was not well crafted, and in medicine, we practice evidence-based medicine. We want to make sure there isn't a bias. We want to make sure there is a real benefit or evaluate a risk in real terms so we don't hurt anybody. We take an oath to do that. Primum nocere, first do no harm. So what I would say is where we currently exist with screening, it's a personal decision that you should discuss with your most trusted medical practitioner, whether that's your family doc or your gynecologist for some younger women. And then you have to weigh the risk-benefit for you. Are you going to be too fearful, too anxiety-driven if we adopt an MRI that's recommended to you based on your risk? But we have to evaluate your risk, treat higher-risk women different than we would average-risk women, and make a decision that makes sense.
Right. And that makes complete sense because some people might have more anxiety and then be more fearful, maybe even put off the testing even longer. So all that makes sense and just goes back to the personal care you get at Doylestown is someone is willing to talk you through that and help you get through some of that maybe potential issues. Speaking of issues, what happens if someone is uninsured or can't afford to come in for a screening? Do they have options at Doylestown?
Thankfully, we do have a lot of options, and it's something that I am very, very proud of Doylestown Health for offering to our patients. First of all, we have a program called the Breast Cancer Early Detection Program, which is we partner with the state of Pennsylvania that provides funding back to the hospital to be able to take care of patients that both don't have insurance or don't have insurance that may cover the testing that they need. So there is some eligibility requirements for that program. You do have to be a resident of the state of Pennsylvania. There is an income eligibility requirement. I am actually the point person to contact for screening for that program, so we'll have the information later about how to contact me for that. But the wonderful thing is that it will pay for basically any kind of testing that is ordered up to the point of diagnosis. So you need the screening mammogram, you need a diagnostic mammogram, you need an ultrasound, you need an MRI, you need hopefully not, but a biopsy. Mm-hmm. All of that could be potentially covered by this program. Mm. So that again is for uninsured or underinsured. You do need to have a prescription, a physician order to participate in that program. If you don't have one of those and don't have insurance, the hospital has the Ann Silverman Community Health Clinic, which is a free, not-for-profit clinic at Doylestown Hospital where they see the uninsured. You have to live in Bucks County. There's, again, an income requirement, but there you can have your physician care, and they can refer you for those testing, and it will be you don't have to pay for anything. Mm-hmm. If you need a doctor but do have insurance, we have a new program with new residents at Doylestown Hospital, the Doylestown Health Family Medicine Residency Clinic, which is at the Health and Wellness Center. You can get almost a next day appointment right now, which is kind of amazing. Get set up with a new doctor. They will also write you that prescription for the testing, and then schedule, get in probably within another week for your test. Mm-hmm. If there is a cancer that's diagnosed and you don't have insurance, another wonderful program that we use, the Breast Cancer Prevention and Treatment Program, which is another state-funded Medicaid program, which will pay for all of your treatment. And there is no income requirement for that program. You just need to be a resident of the state of Pennsylvania. It will pay for surgery, it will pay for chemotherapy, it will pay for radiation therapy, anything that's needed to help get you to that cure. And then also, again, we have the services of a social worker, a breast navigator, survivorship nurse that can guide you through any of these programs that exist, mm-hmm. and make sure that you're supported as well.
To add to that, could I add that on a national level, the Affordable Care Act guaranteed that there would be no copay for individuals who are undergoing screening tests. So that includes mammography, colonoscopy. A lot of people aren't aware of that, and that can be a barrier because they can have high deductible plans. Additionally, if you need other testing, let's say you have a mammogram, but they want to bring you back for an ultrasound. That's not covered under Affordable Care Act, but we have that resource at the hospital. Again, don't let anything be a barrier, but communicate that need. And lastly, on a more local level, in terms of our family practice residency, I have to give a plug for them. They are fully supervised by longstanding, dedicated, very talented practicing family practitioners, board certified. You will never get as much attention from a doctor if you walk in there, and state of the art because they're constantly reading and researching and keep us on our toes.
Yeah, they want to be the best they can. Amy, going back and talking about having the social worker and a navigator with you, if cancer is found during a screening, mm-hmm. what can patients expect to happen next?
Sure. Well, first of all, just to back up a little bit, let's say something just suspected during your screening a mammogram. What could could happen after that? Next, you might go for is a diagnostic mammogram and ultrasound, depending on which side that breast is at. If they're still concerned about that, potentially could get an MRI, could also go straight to a biopsy. And the biopsy is where you'd actually get that confirmed diagnosis of cancer. And from there, then there'd be the referral most of the time straight to Dr. Angadi. If you're staying within the Doylestown system, then she would kind of take it over from there with the other referrals that she felt were appropriate.
Yeah, cancer treatment, whatever site it forms in, has to be personalized. So in medicine, we follow standardized guidelines. That's why we have the high outcomes and the high cures that we do. But within that frame, we're individuals, right? We all vary and have different needs. Some people have dense breasts, some people don't. Some people have financial needs, some people don't. Some people have a high genetic risk, and that can impact the surgery that you pick. So coming to us, that's our philosophy and our approach. We're going to give you state-of-the-art care, but we're also going to look at you as an individual and personalize those things so it's the best fit for the best outcome.
Right, that makes sense. Where can an individual find more information about services and screening?
Sure. So basically, they can call me as a one-stop shop if they like. I'm happy to navigate people through anywhere. But we're putting up on one of these slides that you'll see all the different numbers for our information for contacting. If you just need to schedule your mammogram, you have your insurance already, you have your order. If you don't have insurance and need a mammogram, that will get you right to me. No insurance, need a doctor. There's the information for the Ann Silverman Clinic, the Doylestown Family Medicine Clinic, and if you're coming from another facility, want a second opinion, or just want to consult with Dr. Angadi, she's always happy to talk to anyone, basically, about their breast cancer risk and treatment planning.
Yeah.
And if you can't remember these numbers, and I'd be right top on the list with everything else in my head, just call the hospital, and they'll get you where you need to be.
Right. So I think you can see you won't be left alone if you choose to come to Doylestown. You don't have to go into the city. You can stay out in Bucks County and still get really good care. Thank you guys for joining me today. It was a pleasure speaking to you about everything you do in the community and for Doylestown Health. And for everyone watching, thanks for tuning in to DTV, and we'll see you next time.